Now it's recording. Yeah.
Okay, so we're starting our Donut Hole webinar. Retire Safe interns have put this webinar together for everyone. And we're going to explain the donut hole, not the donut hole in like actual donuts, but in Medicare. So we're going to the next page. We're going to introduce our organization. So our organization is Retire Safe. We are a nonprofit organization, and our mission is to educate and advocate on behalf of mature Americans on issues including Social Security, Medicare, health, safe retirement, and financial well-being. So I put all of the pictures of all of our beautiful interns, and then I put Mark, our president, in the corner, just to clarify that he has more presence in this organization. So we're gonna introduce ourselves. I'm gonna go first. I'm Lila, and I'm the communications intern of Retire Safe.
I'm Maria, and I am one of the public policy interns at Retire Safe.
I'm Catherine, and I'm another public policy intern. And we are missing today, he's a little busy, is Kevin, another public policy intern.
And we're gonna introduce Mark. Mark, would you like to introduce yourself?
Sure. My name is Mark Gibbons. I am the President and CEO of Retire Safe. Again, I'd like to thank everyone for joining us. This is our 30th anniversary of Retire Safe. We will be doing webinars throughout the year to go in and celebrate our existence for this amount of time. This is our first of many. The staff has done a great job. I think you're going to learn a lot of information about the donut hole. So let me turn it back over to them, and please ask some questions at the end if you have anything that you need answered.
Yes.
We also have a really important participant today, one of our board members. I don't know if you want to say hi to everyone. Richard, are you there? I think you're muted. Oh, hold on. You're muted. There you go.
Okay, my name is Dick Weiss. I'm chairman of the board, and I look forward to this presentation this morning. Thank you.
Thank you.
Thank you.
All right. Oops. So we're going today to learn about what is a donut hole, why is it a problem, what are the 4 phases of Medicare Part D, examples of how the donut hole works, how to avoid that donut hole, and at the end, we're gonna have a discussion and Q&A. So we're gonna start with what is a donut hole? It is a period of time in which you pay higher costs sharing for prescription drugs until you spend enough to qualify for catastrophic coverage. It's a third stage, aka coverage gap in Part D in Medicare. Our friend Layla is gonna explain a little bit more about that later. And when your spending reaches at the threshold for the coverage gap, your medication costs can then be higher than they were prior to your reaching the donut hole. However, depending on what you paid during the initial coverage stage, your coinsurance can be lower during the coverage gap. So Medicare Part D is a part of Medicare that is supposed to cover prescription drugs. So why was a donut hole created? Congress designed the Part D so that it will provide coverage for the majority of your prescription drugs. However, a small percentage of a population have medication costs that go well beyond average spending. Part D was designed so that those people will then share a greater proportion of the costs for their medication when they enter the coverage gap. So why is the coverage gap a problem? You only reach the coverage gap stage if you and your drug plan meet a certain spending threshold. So this implies that you have already spent a lot of money prior to reaching the coverage gap, and it affects your out-of-pocket costs.
So I'm going to explain the 4 phases of Medicare Part D. And it's really important to know these phases because then you'll understand the donut hole a little bit better, considering that the donut hole is the 3rd phase. Okay, next page, please. So this is a little graphic that I thought might help explain it better, and I'm going to go through each stage with everyone. So when you have Medicare Part D, we start off with the 1st stage, and this is called the deductible. So what you do in this phase is you pay out of pocket for your prescription drugs until you reach $445. Everyone might have a different number, but for this year, it should be no more than $445. The price changes every year. Uh-oh. Okay, so yeah, 1st stage, you're paying out of pocket and your insurance has not kicked in yet. Once you pay out of pocket until you reach $445, then you meet the 2nd phase. It's called the initial coverage phase. This is when your insurance kicks in. And in this 2nd phase, you will pay co-pays or co-insurance, and you will continue to pay the co-pays and co-insurances for your drugs until you meet another spending threshold. In this case, in this year, it's $4,130. So once you reach $4,130, all your co-pays, your deductibles, and co-insurances have met that number, then we exit this 2nd stage and we go into the next stage. So it's a little confusing because there's different phases in Medicare Part D. And now that we're in the 3rd phase, this is called the donut hole. And the reason why it's called the donut hole is because you're paying a little bit more than you were before. So, okay, yeah, so we're good. In this 3rd phase, the donut hole phase, you're paying 25% of the cost of your brand name drugs and your generic drugs. Where's the other 75%, you ask? The other 70% is by the drug manufacturer. So the drug manufacturer is paying 70% of the cost of your prescription drug meds. And then the last 5% is paid by your insurance. So you pay out of pocket 25%, and you have to meet the next spending threshold to get out of the donut hole. The problem with this is that not everyone gets to this 3rd stage, and you just end up paying a lot of money, and it's a lot of spending thresholds that you have to meet. But yeah, so this next spending threshold, it has to be met by your 25%, whatever you paid for in this stage, and all the co-payments that you had before, the co-insurances and the deductibles, all of those added up. If they are over $6,550, then you can leave the coverage gap phase. So you've already spent a lot of money just to leave it. Now, once you leave it, we're going into the 4th stage. This is called catastrophic coverage phase. This 4th phase is when you only pay 5% of your drug prices. The other 95% is paid for by your insurance plan. And everyone thinks, yay, like we're only paying 5%, right? But you actually have to spend a lot of money to get there. $6,000 is a lot of money before you can reach this last stage. And like I said before, like not everyone will get to the donut hole phase. So in that case, not everyone will get to the catastrophic coverage phase. Yeah, so that was a lot of information. I'm just gonna take a pause and ask, does anyone have any questions, or is this confusing?
Does this 6550 on top of the 4130?
No. So
No.
it's the last spending threshold. It's already including your deductible and your everything you paid in the 2nd stage. Yes.
Okay, thank you.
No problem.
So
Anyone else?
I have a question.
Yes.
So I hardly take any medication, but my doctor prescribed me one medication that's very expensive. It's $800 a month, that manufacturer price. And I found that after 3 months, if I order another 3 months, I get right into donut hole. It was very surprising to me.
Mm.
I
Are you-
understand people who take a lot of medication, but I don't. But because of
Right.
expensive medication, I get right into donut hole. So what you're saying, if this medication, I was told $800 manufacturer price. So my price will be what, $200 a month, 25% when I'm in the donut hole?
That is a good question. I'm not sure how like you'll be paying it because you have to pay a deductible first, correct?
I already done that. Deductible already
Okay.
paid. I already
Okay.
used it for 3 months and I tried
Mhm.
to order medication for the next 3 months. And the next 2 months, I'm still not in the donut hole, but the third month gets me right into donut hole.
Yes, ma'am. This is Mark Gibbons with the president of Retire Safe. So yes, while you're in the coverage gap, the donut hole, you will be paying $200 for the medication until you cycle back out of that again. And is it 800 a month?
Yes, that's what I was told.
So it would be 200 a month out of pocket for you
Yes.
because
yes,
of the donut hole.
until I get out of the donut hole.
Until you
So
get out of the
we're
donut
talking
hole,
about,
right.
we're talking about, say, the donut hole, what is it, 2,400. So another 3 months, then after I get into donut hole, I have to pay 600 myself to get into catastrophic coverage.
Yes, ma'am. So what's going on right now is, and we may cover this a little bit later on, but there is legislation that we are busily watching and working on to try to see if we can do some price caps and also if we can do smoothing and spread this out instead of paying everything at one time during the gap. If we can spread it out over, the 12-month period, so where it's less money. But there are some legislative things that are being looked at right now, and this is why we're talking about the donut hole today, to let you know that this doesn't, it's not a great solution, and we are looking at other legislation, but we wanted to let you know, so going in with your eyes open, what could happen. And in your case, you were experiencing it firsthand, but we want others to understand that this is a problem that we are looking in and monitoring, and hopefully we can reach out to you in the next month or so with some updates on legislation that's going to affect this donut hole and make it easier for patients like yourself to manage and budget your money.
I'm pretty sure there are many patients that don't have even much money, have low pensions, and they have to pay for this medication so much. And I
Yes,
don't
ma'am.
understand how come government allows pharmaceutical companies to charge us $800 a month for medication. This is really unacceptable. That's what we need to fight for.
Yes, ma'am, and we are, and we will probably have another session that's going to just talk about drug costs and the drug pricing and what's being done about that. So thank you for just confirming that is an issue for our membership, and we will continue to monitor that, and we will have somebody reach out to you during this presentation by chat feature and capture your information so I can send you emails and give you updates so you know what's going on and what we're advocating on behalf of on you
Okay.
on the Hill. So thank you for bringing that up, ma'am.
I appreciate it. Thank you very much.
Sure.
Yeah.
good.
And
Oh, sorry. My name is Radha Dutt, and I have a comment also about the costs in the donut hole. My husband is on insulin, and within the first 3 months, he kind of, if he gets a refill on his Novolog and the other medication, he's in the donut hole within the first 4 months. And I think this is because they're based upon they kind of have that $4,100, whichever, based on the total cost of the medication rather than on the co-payment and co-insurance and deductibles that we pay. So that's why it seems to be the total cost, which kind of is like in the $1,200 per, or like 1,000 something, you know, they take that into consideration, and by the time the total cost adds up to 4,000, they immediately have us in the donut hole. So could that be calculated differently? Could that be made like the out-of-pocket costs?
Well, ma'am, this is Mark again. So
Yep.
in the chat feature, send us your information and we'll
Mhm.
chat with you offline, and I'll send you an email, and you and I set up a time for you and I to talk by phone. And I will have a further discussion with you, and we'll do some more research, and then I could talk to some folks and try to find out how this is being calculated in your scenario. Okay?
Okay, thank you. Yeah.
Thank you. So ladies, let's go on and get moving on with the presentation.
Okay, and I just wanted to clarify that when we're in the donut hole, and I mentioned that the manufacturer pays 70%, that 70% is also counted towards the $6,550. So in total, you're getting what's 70 plus 25, like 95% of the cost of your drugs counted towards that 6,550. The 5% paid by your insurance plan is not counted towards that spending threshold. So yeah, I just wanted to mention that to clarify, and we can go to the next page.
So
Catherine is going to give us an example.
I was going to say, to help quantify the information that Lila and Maria have given us today, I created a friend. Her name's Nicole. She's very lovely. So Nicole has a Medicare prescription, or a Medicare Part D prescription drug plan, and she is required to take costly prescription drugs to treat her medical conditions. And hopefully this table will help illustrate the donut hole specifically for this example. Please note that the dollar amount spent on prescription drugs are not universal, and they're going to be different for everyone, every situation, every different drug, and all of those different things. So to start phase 1, Nicole will pay her plan's deductible. Phase 2 is she then plans her or pays her co-payments, co-insurance, and all of those things for her medications. That totaling a $4,130. After reaching that dollar amount, Nicole enters the donut hole after, for this example, 1 month of paying her deductible, co-payments, and co-insurance. Obviously, Nicole is still taking necessary medication, and she can't choose to not. She then continues buying her medications, but at this point in the donut hole, she's paying 25% of her insurance plan's cost for her brand name drugs each month. So for brand name drugs, let's say the plan's cost is $440, 25% of this would be out of pocket $110 for Nicole. So continuing on, Nicole will continue to buy her medications. She pays also 25% of her plan's cost for her generic drugs each month. So she pays 25% for both brand name prescription drugs and generic prescription drugs each month. So for generic drugs, the plan's cost could be $560, and Nicole's out-of-pocket expenses, which is 25% of that, would be $140. So the total medication expenses every month for both brand name and generic prescription drugs would be $250 for Nicole. After 10 months, for this example, of being in the coverage gap, the donut hole, Nicole would reach a total of $2,500. After spending $2,500, Nicole would enter the catastrophic coverage phase because initially for her plan's deductible, co-payments, and co-insurance, she spent a total of $4,130. When adding on her cost of the coverage gaps, generic and brand name prescription drugs, it would total $6,630. In 2021, the trigger that ends the coverage gap and begins the catastrophic phase is $6,550. So even $1 more than that triggers the catastrophic coverage.
So now, how to avoid the donut hole? So one is buying generic drugs, also ordering your medications by mail in advance. Many Medicare D prescription drugs plans offer medication at a discount if you order a 3-month supply by mail instead of picking up a 30-day supply at the pharmacy. Sometimes a local pharmacy can even offer a 90-day supply of your prescription at the same price as the mail order plan. Ask for drug manufacturer discount. Consider extra help or state assistance programs. So some pharmaceutical companies offer their products at a discount directly to consumers or through doctor's office. This is more common for brand names and specialty drugs, which can be expensive. If you qualify, the Extra Help program, also called Low Income Subsidized Program, can provide financial assistance with Medicare Part D costs. You must have limited income and access to qualify, and the specific qualifications threshold may change each year. And shop around for a new drug prescription plan. Every fall, your plan will send your annual notice of coverage. Take a look at it and see if your plan has changed your prescription drug coverage cost.
So is the Medicare donut hole ending? It certainly, given the history with it, has shrunk, but it's not quite to the point that we at Retire Safe or you as mature Americans would like. Since the Affordable Care Act passed in 2010, the donut hole has slowly been closing, and the percentage of the payments after reaching the donut hole has been slowly decreasing. It used to be that an individual could pay 100% of the costs until they reached the disaster coverage. And currently, I wanted to bring up the legislation that Biden's administration has been creating in his solution for numerous different healthcare and Medicare and Medicaid things. So a few of these points that Biden is hoping to solve and resolve with legislation is to limit launch prices for drugs that face no competition and are being drastically priced by manufacturers. So this means that if a drug is the only drug like it on a market and there's no other drug name and drug that does the same exact thing, whoever is manufacturing that drug can ask for a very high price when it's not what's beneficial to the consumers. He also would like to limit price increases for brand, biotech, and abusively priced generic drugs to inflation. He would like to allow customers to buy prescription drugs from other countries as long as the US Department of Health and Human Services has certified that those drugs are safe, because some countries do offer significantly lesser expenses for specific drugs. He also would like to terminate pharmaceutical corporations' tax breaks for advertisement spending, and just in general, improving the supply of quality generic drugs so that it's not only brand name, because brand name is significantly more expensive.
So we are doing a really easy pop quiz. I just wanted to put these questions out there so that way everyone can reflect on what they just learned. You can type it in the chat, A, B, C, or D. So the first question is, what is the donut hole in Medicare? A, a yummy pastry. B, a coverage gap in Medicare Part D, where you temporarily pay 25% of the cost. C, a copayment you pay for your prescription costs. Or D, the spending threshold you meet before your initial coverage kicks in. So you can take a little bit to read over it again and type in chat what you think it is. Okay, I got a couple answers. Anybody else want to type in the chat what they think it is? Okay, great. So it looks like everyone chose B, and that's correct. The donut hole is the coverage gap in Medicare Part D, where you temporarily pay 25% of the cost for your medicine. So that's good. I'm glad that was very clear. We're going to the next question. What are the 4 phases in order of Medicare Part D? You can take a look at it and see what the 4 phases are. Thank you for everyone who answered in the chat. So it looks like everyone got this down. So in order of the 4 phases of Medicare Part D, it goes from the deductible, when you're paying out of pocket and your insurance hasn't kicked in yet. Initial coverage, when you're just paying co-payments and co-insurances until you meet a spending threshold. The coverage gap, where you pay 25% of your medicine costs. And then once you reach the next spending threshold, that's when we get into the catastrophic coverage, where you only pay 5%, which is good. Everyone seems like they got the answers down, and we're gonna go to the last question. Easy, really easy question. It just says, what percentage do you pay for your prescription drugs when you're in the coverage gap or donut hole? Feel free to type it in the chat. Yay, thank you, Al. Thank you. Yeah, so thank you for everyone who answered this really easy pop quiz. I'm glad. I really hope that everyone learned something. It is 25% when you're paying out of pocket when you're in the coverage gap. So we can go to the next slide. And now we just want to open up the floor for anybody with questions or thoughts that you have on Medicare Part D, the donut hole. Any comments or concerns?
You can type in the chat or just unmute yourself.
Is it okay to ask? Oh, okay. I don't, this doesn't affect me, but it could, some of my grandchildren eventually. Is the EpiPen and those type things more expensive now? I know it was under the prior administration, it was reduced, but I heard it went back up. Is that true? Do you know?
I'm actually not sure. Maybe Mark can answer this one.
Luis, I know it's gone up a little bit. I don't know the exact cost. It's not at what it was previous.
Oh,
I know it was
good.
an astronomical, but I'll have to find out that answer for you. I'm not sure if
Somebody's giving me the answer right now.
yeah, I don't know the answer, and like I said, I'll have to get back to you on that. But I know that it's not as high as it used to be. I know we were paying almost
Right.
almost 1,000, and I
Yeah.
know it's not at that level right now.
Okay, that's sufficient. That's okay. Thank you.
Thank you, ma'am. Thank you for asking.
I also just wanted to jump in and let everyone know that we will be sending out these slides with this information that we've given you today in an email so that you can also have this at your disposal.
Feel free to like type in the chat or ask anything really. We're open.
Or if you don't have a question right now, you can always send us an email, and we'll be glad to respond a little bit later on. I mean, I know it's a lot of information to take on, and you may be, we may have confused you with some numbers here and there. So please, ladies, if you can give them an email address to send some questions, you can give mine if you need to or whatever, and we can go from there.
It looks like James, your hand is raised.
Well, it looks like no one has any more questions, so we can just head on to the next slide. And we just wanted to thank everyone for attending our first webinar of 2021. Woo! And we have more webinars coming soon in honor of Retire Safe's 30th anniversary. So stay tuned on our Facebook, and we have an Instagram. And everybody who attended the full webinar will be entered into a raffle for a $20 Dunkin' Donuts gift card. So thank you, everyone.
So in order for us to have the drawing, if you would just in the chat feature, just send us your name and your email address, and we'll have the drawing probably within the hour, and we will notify the people so we can figure out a way to get you your gift card. So thank you again. And we'll leave it on for a few minutes. I know that I have some people sending their emails like Bianca and Kaylin. Thank you.
And I think when people register, they put in their emails too.
Did they? Okay, good. So
yeah,
and
so
we
hopefully
have
we can get
everybody
that.
that attended.
Thank you, Ratu.
And if there's any other topic that you think you want to talk about, or that you're concerned that we need to advocate on behalf of for you, please feel free to reach out to us. I know we're going to be talking, we'll be monitoring the Medicare. We're talking about COLA, the cost of living adjustment, Medicaid. I know that they're looking at doing some more things with the Affordable Care Act here shortly. We'll be monitoring that. So if there's any topic that you're concerned about as you are in your retirement years that you want Retire Safe to look at, please feel free to reach out to us.
Mark, did you see this question in the chat?
Yes, so Al, our organization is funded through grants that we apply for throughout. We do not receive any type of government funding though. And our grants are all, has to do with the public education grants. Well, thank everyone. Again, great job, staff. And we will conclude today's webinar.
Thank you, everyone.
Thank you.
I'm just going to copy the emails dropped in the chat.
Okay.
Oh, also, don't forget to stop the recording.
Yep.
Yeah.